that what is it that is harming the development of the child's potential. And there are various factors. You will see what defects can occur at birth. Any genetic factor, any chromosomal. We saw in the ward when Down syndrome which was there, and how this child is going to have problem. But again, you saw a very good thing. The interaction which was happening between the mother and the child was fantastic. And a Down syndrome at the age of 11 months, right? It was 11 months now. The child was trying to stand up and do whatever normal could do, which you don't expect. But this is the importance of early child development. So you can see Down syndrome. They can be cleft lip and cleft palate. These are all the RPSK phenomena which they have to understand why this is happening. Please see, there are many factors which are affecting this defects. It could be due to, I told you, genes. It could be due to chromosomal. It could be due to drugs which the mother has taken. It can be due to some uterine factor. If the uterus is bicoordinate and the fetus is going on one side, that means the development of the limbs and organs has got. Also, you can see if a mother has got rubella infection or she's got cytomegalosis infection, then that can get congenital cataract. Or if it's an extreme preterm baby, then she can get retinopathy of the prematurity. On the other side, what you see is delay. That means it is affecting the function of the child. He had cataract. If it is not operated, we get problem of the eyes. He had congenital deafness. That's what we saw. It's very important to find out whether the child has got deafness due to what. You can intervene and give cochlear implants. The child can hear. This is being given now from 6 months onwards. And it is free. So it is very important for us to diagnose this thing and refer to proper center so that the baby gets advantage of this. Then you can see that motor delay is there. Can be due to global or neurological problem. Cognitive delay, language delay, which I told you that is expressive or responsive. Both of these factors are very important. And please remember, don't label any child as autistic child. Autism, nobody knows exactly. They may say it is due to gene disorder. Somebody may say it is due to pollution in the air. Somebody may say it is familial. There are many factors. But to diagnose them is very important. And the important thing is, if a child at 3 months does not look into the parent's face, mother's face, please follow that child up. We just take it 3 months. He is not looking at the mother. Today we saw a child who was nearly about some level of 3 years or some. He had another neurological problem. But at that time when we went, he was not looking at anybody. So everybody will label him as autistic. But how you interact with the child, immediately you will see the child is looking up to you. Don't label a child very early. But what is very important lesson for all of us to know is please follow them up. If you have found some defect or something which is not normal, follow that child up and you will see it's alright. Why did I label him as autism and we didn't go through all the tests? And that is very important. It's a stigma. Parents get frightened and everybody tries to say different stories. So please do not label any child unless it is properly seen. Next one. I am only putting up this picture since your doctors to make you know. It is the first trimester where maximum abnormality can take place. That is the embryonic stage. If you look at it, all the defects, that is the neurological system, brain goes right up to the nearly amdama is about. Something can go wrong. But anatomically, the brain also goes up to the second trimester. So the first trimester is a phase where maximum defect can take place in the limbs, in the heart, in the eye, even in the teeth, even in the eye and genital urinary system. So what obstetrician or colleagues should do, take care of a child very closely and monitor up to first trimester. The second and the third trimester, sometimes yes, you do get defect, but functionally the second trimester the problem occurs. If you look at this timing of the air pollution, today with climate change and various factors which are affecting, you all must be having heavy rainfall, flooding. The Chinese people, they are moved out from their house. The child may not have, parents don't have a house, don't have smooth to sweep. All this affects the growth of the child. Placenta does not function. You also know the toxemia of pregnancy which occurs in the third trimester. Baby is doing very well. And all of a sudden they will notice the monitoring the baby's weight is going down. The mother who has to get 11 to 12 kg throughout pregnancy, you will see that her weight is going down. So factors are there which is really opening and they are telling us. But now let us see how this is affecting the child. Next one. I'm just putting up this picture of the brain. Alright. I've just put up, this is the first trimester. Okay. This is the trimester where you will see maximum neuronal mean nerve cells. They are proliferating in division. Then they are getting differentiated, whether they have to go to this part of the brain or that part of the brain. And then they migrate to that part of the brain. So there is division, there is multiplication of these nerve cells, and they are going to the destination where they have to go. If they have to go to this emotional thing, they go to the frontal lobe. If they have to go to something where they have to walk properly, they go to the cerebellum. If they have to see, they go to occiput. And so, what is very important for us to know, that the brain cells are dividing, they are proliferating, they are connecting, that is synaptogenesis, which we call this wiring which goes on. And at each stage of gestation, you will see that the migration and synaptogenesis are very, very important. Later on, you will notice that myelination comes up. But see, what is going on is your synaptogenesis, that is wiring, and myelination. What happens after birth of a child? And please remember, the first 6 months, the maximum myelination proliferation takes place. And that is where you have to be very, very careful. Intrauterine, it is mainly because of the division of the nerve cells. So if that is at fault, we will have congenital malformation, what I showed you. But after birth, what really happens is the myelination. That is affected by nutrition, and that is because of the myelination which does not take place. First 6 months, maximum metabolic activity goes on in the child's brain. And that is where you have to pick up. It is affected by malnutrition. It is affected by some amino acid program which is not normal. It is affected by hypothyroid hormone. So you can get a child who is creative. And all this can be prevented. It's not that you can't prevent. It's that you have to take care during the phase of the child. This is the phases which are 1 week. You can see only 28 grams of weight is there in the first trimester. The mother may have vomiting or is not able to retain only 28 grams. Now as the child matures, the child gets 1000 grams in the second trimester. And then you can see 2400 in the third trimester. And then the child comes out, good nutrition, good stimulation and all, he comes out at 3 kg weight. But what you have to be very careful is, this part of the brain is growing. So when we say how does it develop, it is development of the neurodevelopment process. That is all. Connectivity also which is very important, the wiring which is very, very important. And so that is where you have to be very careful, and that is where your obstetric planning comes into play. So what are the factors which affect these problems? So if you look at in the prenatal, during pregnancy, what are the factors which can cause some defect? And most of it is genetic factor and the chromosomal factor. Then we have intrauterine infection. You are all very well known. Rubella can cause heart disease. Rubella can cause congenital cataract. It can cause deafness. It can affect the liver and the reticular endothelial system. So rubella infection can be prevented right from birth. It can be prevented, and in a girl in that stage, yes, rubella vaccine. So it can be prevented. Can we prevent CMV virus? Torch virus is all. Syphilis can be prevented. Yes, can be prevented. Penicillin is the best drug which can prevent it. Toxoplasma can be prevented. Those are all intrauterine infection which can affect the brain growth. It can cause microcephaly. CMV virus can cause microcephaly. So toxoplasma, if you are working in a laboratory with something going on with cat, It's very important. Don't pick up the litter of the cat because it's the one which can cause infection. So there are certain things we know instant cause this brain development goes off. Now there are drugs which are given to the mother. There are many drugs which are given during pregnancy because it's for hypertension or say epilepsy and all the drugs passes through the center to the baby and it can affect the baby. So if you know, you should be careful. Another thing is smoking. We know if a mother is smoking or if she doesn't take smoke, our mothers can chew tobacco or they take that pan and with masala and whatever they do. Nowadays, I know that women even take alcohol. You go in the tribal area and I can tell you, not that the only husband drinks, even the woman drinks. They spend their time drinking in the evening and in certain plants there are certain flowers in the Velvet you go, beautiful is, which has got alcohol in it. So please, you have to remember, it affects the fetus which is growing and then you will have low birth weight, increase. Somebody will blame the child, but it's not the child, the mother has to take care. And also drug addiction. There are many ways in which the things are going on. So we have to find out whether these things are there because fetus does get affected during the swing season there. So if a mother is anemic and the hemoglobin goes less than 7, that's what we are very worried about because majority of our mothers are there. The oxygen carrying capacity to the fetus goes down and intrauterine hypoxia and the child may come as birth asphyxiation. See, if a mother is given general anesthesia, we are worried because the same phenomena occurs. The child is already comes out and he will have breathing difficulties. If a spinal anesthesia given, it is like a sudden shock which can happen and the baby's immediate drop of oxygen takes place and they both can come out as intrauterine hypoxia or what we call as birth asphyxia. And whatever result Jessica sent to me, I found that sepsis, prematurity and birth asphyxia are quite common here. And the phenomena, what is happening is either the labor room is not good or the mothers are overdosed. And please remember there are many mothers who take this like epilepsy, they go on phenobarbital or phenytoin sodium. All these causes a problem with the growing baby. So if you know that a mother has got diabetes or she's got hypertension or any of these causes, we know what can happen. It can give rise to polycythemia in a small body baby. If the mother has got this phenomena, then we have to be very careful. Diabetes, you can get very huge babies using it. But the child will have polycythemia and have heart problem because of, again, it can give rise to hypoglycemia, hypothermia. These are phenomena which occurs more in low birth weight babies, but also in mother who has problem, the baby will have the same problem. So we have to be really very careful when you talk of it. And as I say, perinatal cause, I will say many deaths are occurring when a child is referred from one place to another hospital. And if it is like here, Meghalaya, where the environmental temperature is so very low, many of them will have hypothermia. And unless and until you tell the mother, and I say KMC is the best method to transfer any baby to a center to prevent hypothermia, hypoglycemia, both. And these two things can really kill the baby. And you will write a cause of death as low birth weight babies, cause of death, birth at swing. No, it is a metabolic problem which has killed the child. So we have to be very, very careful with these cases. Then of course you have postnatal infection. Again, infection is very common. Unfortunately, sometimes we do have pyogenic meningitis. Child can get suffocated by drowning. They want to play. See, remember we are saying let them play. They want to play in water. They want to jump into the water. But if you don't recognize and you're not around, they may do something and they may drown. Then how do you prevent it? There's a very beautiful slide which I showed towards the end to giving the answer. Lead poisoning, we have seen it. The Sindhu which they put up the routine one. But there are one culture and custom where they put that orange color, which is loaded with lead. And then because we had a baby of 3 months who was extremely pale and we just couldn't find out any factor. And then we saw the mother who used to open the mouth, used to put that left finger into the baby's mouth, and then just will get palsy. He had to functionaries and all those factors. But I'm just telling you there are certain things we don't know. But if you see something like that, please see that it is stop. Nutritional factors, I repeat again. There are various ways we maybe try to take the preconceptional nutritional. Unfortunately, our government is not ready to give multiple micronutrient tablets to the mothers, which has got everything in it. You don't have to pop 10 tablets to be, you see that she doesn't have anemia, she doesn't have vitamin A deficiency, she doesn't have it. Everything is there, but they don't want to give. And if you ask the mother to take 10 tablets a day, he will hardly take it worth and leave the rest. And in the fourthly, we may miss vitamin A, we may miss zinc, we may miss iron, and we may miss folic acid, I told you. Some very, very essential. So one tablet for multiple micronutrients can do wonders for them. But as I say, no. Malnutrition is very common. Anemia is very common in the majority of community which we see in the villages in the tribal belt. And they really can make a lot of problems for the fetus which is growing.